So, hi everyone. You're welcome again to our basic chemical pathology series. Our interesting topic for today will be dehydration. All right, my name still remains Dr. Zibasi. And please, before I go on, don't forget to like, subscribe, share our videos to somebody else who may actually need to learn from this. Drop a comment for us if you have a question, if you like what we're doing, if you think we can do something better, please just drop a comment for us. If you don't have time, drop an emoji. We'll appreciate it and I'll get back to you. So, what are our learning objectives for this session? I would feel that you should be able to define dehydration and describe the different types of dehydration, the different stages of dehydration. Then you should also be able to tell me the signs and the symptoms, what causes dehydration. And you should also be able to explain the physiological and biochemical consequences of dehydration. So, what is dehydration? I'm just going to put it very simply. It's just a condition that occurs when the amount of water leaving the body is greater than the amount taken in. You remember when we were talking about water balance, I said the amount of water you gain must be equal to the amount of water you lose. So when the amount of water you are losing exceeds the one that you are gaining, you have a condition called dehydration occurring. If you want to speak about it clinically or medically, it states that dehydration is a condition when a person has lost enough fluid so that the body begins to lose its ability to function normally and then begins to produce symptoms related to fluid loss. All right? So if we have that in, and we do understand that when water lost is greater, then the amount of water lost is greater than the amount of water gained, dehydration will set in. And this dehydration may range from mild to moderate to severe. Okay, if you have mild to moderate dehydration, it can be reversed by drinking more fluids, all right? But if you do have severe dehydration, you may actually need to have medical treatment. So the different types of dehydration we have are isotonic dehydration, in which case you're losing equal amounts of water and electrolytes. Then you have hypertonic dehydration. In this case, you're losing pure water, just pure water, and then hypotonic dehydration. When you talk about isotonic water loss, you're losing both water and sodium. All right. And this kind of cases occur when you're vomiting, if you have diarrhea, if you're sweating, if you have, well, when I mean sweating, I mean profusely sweating, if you have burns, especially those of the second and third degree where you're losing fluids, from your body, losing fluids that look more like plasma from your body, and then intrinsic kidney disease, hyperglycemia, high levels of sugar, hypoaldosteronism. So if you have these kinds of condition, the kind of water loss you will be having will be the isotonic water loss, resulting in isotonic dehydration. Another type we'll need to look at is the hypertonic dehydration. So what does hypertonic dehydration mean? In this case, you're losing much more water than you are losing sodium. In the other one, you were losing both water and sodium, but in this case, you're losing pure water and less sodium. So what will happen is that you are going to have an accumulation of sodium inside the body. And I did tell you that sodium was responsible for more than 90% of, osmotic pressure. The iron responsible for more than 90% of the osmotic pressure. So when you do have accumulation of sodium in the body, the osmolarity of the body will be increased, okay? And this will result in hypertonic dehydration, all right? The kind of condition that you would have that will make you lose that kind of pure water is water loss that occurs through the skin, through the lungs, to the kidneys, okay? You kind of find that when you have fever, also when you have increased respiration, hyperventilation, and also when you have diabetes insipidus. Diabetes insipidus is different from diabetes mellitus in that it is caused by a dysfunction in ADH activity. All right, so we actually said that ADH is responsible for reabsorption of water. So when your ADH is not sufficient, or if it is not active because maybe there's a genetic problem with it, then you would have a person producing very dilute urine in very large quantities. This kind of loss of water without loss of sodium would result in hypertonic dehydration. Do we understand? If you do, just give me this kind of thing in the comments. So the last type of dehydration we'll look at is the hypotonic dehydration. So in this case, you are losing much more sodium than you are losing water. So anything, any drug, any condition that will make you to expel sodium without expelling water can cause this type of dehydration. So you would find out that you will have less concentration of sodium in the body. Like we said, sodium is responsible for 90% of osmotic pressure. So you will have the osmolarity, of the ECF reduced. Okay, and the kind of things that can cause this are diuretics. These are drugs that usually are given to people, especially hypertensive, that help them to get rid, of water. Some of them act by getting rid of sodium. All right, so those type of drugs can cause this kind of dehydration, and you would have, like I said, low sodium and low osmolarity. So what are the signs and symptoms of dehydration in infants? The kind of symptoms you will have in infants actually differ from that you will see in adults, okay? I told you before that infants are made up of 70% of water, and because of their large surface area to mass ratio, they can lose, a lot of water, which is why babies need to be rehydrated, and if for any reason they are losing water, you need to be able to stop, whatever is causing that loss of water so that they do not get dehydrated. All right, so the type of symptoms you see in young children include dry mouth and tongue, and when they cry, you don't see tears. They may not be able to pee, for 3 hours that long, Most times the children are always peeing because the concentrating power of their kidneys is not as strong as that in adults. So you find them peeing dilute urine. But in this case, if a child is dehydrated, you may not pee for 3 hours at a stretch. If you do look at such a child, you may actually see sunken eyes, and cheeks. You may see a sunken soft spot on the top of the skull. When you look at the top of the skull of a child, you will see something like a small pothole here. All right. If you touch the place is soft, very soft. There's no bone there. So when it's dehydrated, you see instead of that place just being soft, it becomes like a crater, like a small crater, like a small pothole, So that sunken soft on the top of the skull is all a fontanelle. All right, so it becomes sunken, and then they may cry a lot, they may look very weak, everything irritates them, and all that. Okay, for adults, if you have mild problems or mild dehydration, the symptoms may be different from that you see in severe dehydration. For mild dehydration, you could have things like just increased thirst, dry mouth, is tired and sleepy, there's decreased urine output, most likely oliguria. The urine is small and it's very concentrated, so it will have that kind of yellowish color, much more yellowish than normal. Some people you will even see brown. Yeah. Some cases you can see brown. And then the person has constant headaches, that those ones are cerebral symptoms, neurological symptoms. You have dry skin, the skin is cold and clammy, dizziness, few on your tears. But for the severe one, you could actually see no urine produced at all. And the person walks as if he's drunk, that is ataxia. You may have low blood pressure when you stand up. Suddenly you may just have low blood pressure, which is called orthostatic hypotension. Your heartbeat is very, very rapid tachycardia. And then you could have fever also. Then poor skin elasticity, apart from being cold and clammy, you now have poor skin elasticity. When you raise the skin up, it doesn't go down back again. It could be weak, confused, could fall into a coma. It could even have seizures that look like epilepsy and all that. All right. So what are the conditions that can result in dehydration? You could actually have fever. Yes. Because when you have fever, you sweat a lot. All right. And then you can lose water. Heat exposure, if you expose yourself to very high temperatures, yes, you might become dehydrated. Imagine yourself inside the Sahara desert. You don't cover yourself well. You don't have water to replenish yourself. Yes, you will become dehydrated. Then if you have do a lot of exercise over a period of time, prolonged exercise, yes, you may actually have dehydration. When you vomit, you also lose a lot of water alongside acid. Yes, that can also cause dehydration. When you do have diarrhea, you lose a lot of juicy fluid, a lot of rich fluid, a lot of rich fluid, bicarbonate rich fluid, because of the pancreatic fluid that is being released. So you also have dehydration. Then when you have polyuria means producing a lot of urine over time, a lot of urine per time, a lot of urine over time. So you could have polyuria due to diseases such as diabetes mellitus and diabetes insipidus. I'd already explained what diabetes insipidus was. For diabetes mellitus, in this case, you do have hyperglycemia, high blood sugar, because your insulin is either not there or it is not working. So what happens is that you now have excess glucose in your body, which filters out into your urine. Then also, if you are not able to drink water or food, maybe because you're an infant, you've been abandoned, or you're disabled, you do not have access to drink water, or you are even in a coma, you could also have dehydration. Then when you have significant injuries to the skin, like if you are burnt, or you have these skin diseases where your skin peels off and, allows exudates to come out, you could actually lose water through the damaged skin. Then hemorrhage, for any reason, is it an accident? Are you giving birth? Whatever can cause you to bleed will cause you to get dehydrated. Okay, alcoholism, drinking, alcohol over time can also cause you get dehydrated. Addison's disease, where your adrenal cortex is not working, okay, can also make you have dehydration. Then if you do take diuretics, I told you what diuretics do. They are given to you to help you to expel fluid out of your body through the urine. So if you take it for a long period of time, you would get dehydrated over time. So what are the physiological consequences of dehydration? There are, yes, effects on the cardiovascular system, because when you lose water in the ECF, what happens is that your blood volume also reduces. If your blood volume reduces, you should also know that your blood pressure is going to reduce. So you are going to have what is called hypovolemia, that's low blood level. You're going to have your blood pressure will drop. So in order to counteract this drop in blood pressure, you would have your heart beating, stronger. You would also, because the blood fluid is lost from the blood, I told you that water is a very important part of blood. You will also have a thickened kind of blood. Your blood becomes thicker. You have what is called hemoconcentration, that is thickening of the blood. And once blood is thick, just like any thick fluid, the flow will also reduce. Okay, so this will make the heart want to beat faster because the blood pressure has fallen. The heart will want to beat faster and stronger to be able to pump more blood. You would have also constriction of the blood vessels so that you can increase, total peripheral resistance, okay, in order to increase the blood pressure and get blood to other parts of the body. And when it gets to a stage where dehydration is becoming severe, the body tends to enter into a conservative mode where it kind of like conserve circulation to important organs, core organs like the brain, like the heart, like the liver, like the viscera. So you will have it sacrifice the skin and the muscles. It will draw out blood from those areas, from those circulation, and from those circulatory areas, and then concentrate it on, those important organs. So what will happen is that since circulation is reduced to the skin and to the muscle, you will have less convection of heat, from the skin. So what will happen is that the skin becomes cold and the skin becomes clammy, all right, in order to save the more important organs. So you will now have that the person, your skin will lose its elasticity, it will be very cold, it will be very clammy and all that, okay? So another thing that happens is that when blood pressure is low, renal blood flow will also be reduced. And if renal blood flow is reduced, you know that glomerular filtration will also be reduced. And if glomerular filtration is reduced, what will happen is that you are going to have a decrease in the amount of urine being produced. So you may have oliguria, you may have anuria, all right? Oliguria is producing very little amount of urine, below 500 mils, about 400 mils and below, and anuria is you're not producing any urine at all, okay? So these can happen to the kidneys. Besides that, there are baroreceptors in the kidney, okay, that sense this low blood pressure and kind of stimulates the cells of the justa glomerula that are located in the macula densa to produce your renin. Okay, production of renin would activate the renin-angiotensin-aldosterone system, which kicks in also to fight the effects of this low blood pressure, the effects of this low blood volume, the effects of this low ECF in a bid to return back the system back to normal. All right. So renin protein cleaves angiotensinogen to give you angiotensin 1. I've already explained it in the other video. Cleaves angiotensinogen to give you angiotensin 1. Angiotensin 1 is cleaved by ACE to give you angiotensin 2, which also stimulates thirst, stimulates ADH production, and stimulates aldosterone production, which helps to reabsorb sodium. Okay? Then you could also have effects on the brain. Over time, when the brain loses about, I think, 5 to 10%, you begin to see water, you begin to see neurological symptoms, begin to see things like lethargy, dizziness, weakness, ataxia, seizures. The person can even have coma and then even die if you do not take care of it. So dehydration has very, very severe effects on the body. All right? Then also biochemically, there are consequences of dehydration. You could actually see oliguria or anuria. I've explained what that is. And because the blood, you've lost water, especially when you lose water without losing cells, all right? You could also have an apparent increase in PCBs, as if your PCB has increased, but your PCB actually has not increased. It's just high because you are dehydrated. So you can have an apparent increase actually in PCB and protein. And because your kidneys are not filtering and getting rid of waste, you will have accumulation of nitrogenous waste products in the body, such as urea, such as creatinine, because your kidneys are not being perfused. the filtration is not occurring as it should, excretion is not occurring as it should. So you have accumulation of these things in the body. All right, so if you were to measure urea, you were to measure creatinine, those levels will be high. Then you could also have electrolyte imbalance, depending on what is causing the electrolyte imbalance. Let me take, let me take vomiting. So if you are vomiting, you are losing water, you are losing acid. Acid is made up of what? The gastric acid is made up of HCl. Okay, so you are losing hydrogen, ion, you're using chloride. Okay, amongst other things, maybe some sodium. So if you actually look at the electrolyte imbalance, because you are losing a lot of hydrogen ion, you will have an increase in bicarbonate, okay? And when you have increases in bicarbonate, it could also, because you're losing some sodium, you're going to have decrease in sodium, you're losing chloride, you're going to have decrease in chloride, and all the attendant symptoms that come with that electrolyte imbalance. But on the other hand, let's look at diarrhea. If you do have diarrhea, remember I told you that when you're having diarrhea, you're losing fluids that are rich from the pancreas, rich in sodium, rich in potassium, rich in bicarbonate, and other very nice things. So if you do have diarrhea, the kind of electrolyte balance you have, because you're losing sodium, you will have hyponatremia, you're losing chloride, you have hypochloremia, you're losing bicarbonates, you are going to have low bicarbonate levels, you're losing, what else are you losing? Potassium, you're losing potassium. So you're also going to have what is called hypokalemia, okay? You could also have acid-base imbalance depending on the cause of the dehydration. Let's go to vomiting again. If you do have vomiting, because you are losing acid, you are going to have increase in bicarbonate. So you're going to have what is called metabolic alkalosis. For diarrhea, because you are losing bicarbonate-rich fluid, you are going to have what is called metabolic acidosis. Yeah, you're going to have metabolic acidosis. So you see that different conditions can have a different acid-base imbalance. All right? Okay, so how do we manage dehydration? First of all, you have to assess the degree of dehydration. Is it moderate? Is it mild? Is it severe? If it's mild or severe, you can just give the person oral rehydration therapy and it ends there. But if it's severe, you have to do much more things, clinically be able to investigate the cause of dehydration. You have to, because of the different electrolyte imbalances, acid-base imbalances, blood glucose abnormalities, you also have to manage those by giving, the right medicines that can take care of these issues. And then you also provide rehydration. I've already mentioned the oral rehydration therapy. Also, sometimes you can be rehydrated by putting an IV, IV fluid into the body, parenteral administration of IV fluids, appropriate IV fluids depending on the condition of the person. You could give normal saline if the person is diabetic. You could give dextrosaline if the person is not diabetic, and add some other things that can help to take care of the electrolyte imbalances and blood glucose imbalances that you have seen. All right. So I want to thank you for listening to this video. Like I've always said, you are the best, best viewers ever. Please don't forget to subscribe. Don't forget to like our videos. Don't forget to share to people all over the world. I know that people will benefit from you. And I want to say thank you to fppt.com for use of their free templates. I want to say you are awesome. Thank you very much. Take care until I see you again. Bye. Bye-bye. Take care of yourself. Bye.